Hello everyone, welcome to my honors option presentation for Physiology 310 on congestive heart failure. In this presentation, I will be discussing the causes and symptoms of heart failure, how it affects the body, how it's diagnosed, and lastly how it can be treated, prevented, and controlled. Before we look at how a failing heart works, it's going to be important to first understand how a heart is supposed to work. As we discussed in the lectures, blood is going to flow in a laminar fashion, and the heart's going to empty with each contraction, then fill up again and contract. Most importantly, cardiac output is going to be consistent when a healthy heart is at rest. There's going to be little alteration from about 5 liters per day. Lastly, it's important to note that the ventricles pump blood, the ventricles are the main source of that pumping force. And it's also going to be important to note which side sends blood where. So in this diagram here, you can see that the right side, or the blue in the diagram, is sending blood to the lungs. The left side is receiving blood from the lungs and sending it to the rest of the body. And again, ventricles are going to be what sends that blood. The atria are going to receive the blood. So let's go ahead and define heart failure. So what exactly does heart failure mean? Heart failure does not mean the heart has completely stopped working. The heart is still functioning, however not at an optimal level. So heart failure also is going to differ from cardiomyopathy. Cardiomyopathy is an umbrella term used to describe diseases of the heart where there's noticeable changes. It's a good umbrella term. Heart failure can affect either side of the heart or even both, and we'll see that in just a minute. And it is also important to note that heart failure can be asymptomatic. This is that compensated heart failure we'll talk about, where the body is going to respond as to not allow any symptoms initially. This would be in early stages of heart failure. So what can cause heart failure? So heart failure is going to begin when the heart loses its ability to contract normally over time. Over time is important because as soon as that reduction in cardiac output occurs, symptoms won't be prevalent. It takes time for those symptoms to build up. So in order to make up for this reduced cardiac output, the heart can start to pump faster, increase its contraction force, or increase its internal volume. And what's telling the heart to do this is there's not enough blood going around in the body, not enough oxygen getting to certain tissues, and these tissues are going to tell the heart that it needs to compensate for this. All three of these compensations the heart does will actually, in the long run, increase the effects of heart failure. We'll get to that shortly. However, the body and the vascular system can also help compensate for a failing heart, and what that will result in is constricted vessels and neglection of more important tissues where less blood is going to be going to these tissues. In particular, this would be the legs, ankles, and feet, and the kidneys. And this is initially going to lead to that compensated heart failure I've mentioned a few times, where there's not as many outward symptoms initially. Moving on. So some physiological changes due to heart failure. We're going to focus on the left side on the slide. So as I said earlier, we could see left-sided or right-sided heart failure. Typically left-sided will exist by itself, but we won't see right-sided heart failure alone. That typically has to happen in conjunction with the left side. So a lot can happen when this left ventricle starts to fail. Firstly, we're going to see a reduction in cardiac output. So as I've mentioned, we have less blood moving throughout the system. Since ventricles are what causes that pumping mechanism. This is going to lead to decreased blood pressure, and baroreceptors are going to relay messages to constrict the blood vessels. This is going to be a similar mechanism to what happens in a hemorrhage, as the body's getting the same stimulus. There's less oxygen, so the body's going to respond in a similar manner. However, that's actually going to increase the effects of heart failure and have more, not necessarily severe, but increase the intensity of symptoms of heart failure. We'll get into that mechanism later, but that's just important to keep in the back of your mind for now. So going back to blood vessels, we're constricting our blood vessels, but we have the same amount of blood in them. It's just the blood's not moving as quickly. So as you can see, I have inserted a figure here that shows you how edema is going to work. As some of you might know, edema is a very good indicator of heart failure because as we're constricting these blood vessels, we're going to increase hydrostatic blood pressure, which is pressure of fluid leaving the vessels. And that fluid has to go somewhere, and that somewhere is the extracellular fluid. If we increase that, we're going to get that swelling or edema. So moving on to the right side of the heart. Right-sided physiological changes are going to be mostly based in the lungs and pulmonary system. So if we're getting reduced cardiac output to the lungs, less blood to the lungs, we're going to get sort of stagnant blood as we're having less pressure to push that blood forward in the circulatory system. And that's going to lead to edema in the lungs and the chest cavity, which is why in patients with both-sided heart failure, again, right-sided doesn't typically occur alone. It's typically with the left side as well. We're going to see that swelling in the lungs and chest cavity, and that's just that deposition of fluid. And this becomes really important when we get into testing for heart failure, as many heart failure tests are going to rely on this increase in fluid in the lungs and chest cavity. Furthermore, lack of gas exchange from less blood movement is going to lead to less oxygen to the kidney, which, if you remember from our physiology lectures, is going to stimulate erythropoietin secretion. If you remember what erythropoietin does, it's going to increase our red blood cell count. Red blood cells will carry hemoglobin. Hemoglobin carries oxygen, and this is another good way clinicians will test for heart failures, looking for increased hemoglobin concentration. But we'll discuss that in just a second here. So in terms of outward symptoms, these are things that a clinician or a patient might notice, because it can be kind of tough to look at somebody's vasodilation to decide, okay, their veins are constricting, they probably have heart failure. So things to look for on the outside, or things you can notice. So electrical problems are a big thing with the left side. So if you think about it, the heart's going to try to overstretch in order to pump more blood with each contraction. It's increasing that internal volume. And what that can actually do is that can reduce the ability of things to work in sync. And these can cause two different electrical problems. Firstly, atrial fibrillation, and secondly, ventricular tachycardia, or a faster heartbeat in the ventricle compared to the atria. So what's interesting about this is AFib can cause heart failure, and heart failure can cause AFib. So in this diagram here, you can kind of see how that works. So what's going to happen is our heart is stretching, electrical systems fall out of sync, which causes our AFib, that fluttering of the atria there. That's going to do is we're not getting that preload in the ventricle before contraction. So we're having a decreased cardiac output. Decreased cardiac output, the heart's going to need to stretch more, which is going to cause more electrical dysfunction, which is going to cause more AFib, and it's just a cycle that snowballs in on itself. Another thing a patient might notice that might direct them to go visit a cardiologist is a lower blood pressure. As many elderly patients who may be experiencing heart failure are told to monitor their blood pressure when they have high blood pressure, or chronic high blood pressure. And they might notice that it's starting to dip over time. And they may think this is initially a good thing, but this can also be a sign of heart failure. Another is dizziness or lightheaded when standing up. And what this is a sign of is the blood with oxygen isn't getting to the brain. And when somebody quickly changes their positioning, that blood's going to start to rush to other places as they're moving. And the concentrations of oxygen are going to change rapidly. So moving on to the right side, again, this is where we're going to see most of our pulmonary symptoms and side effects. So again, right side is usually accompanied by left-sided heart failure. It's very rare to see just right-sided because if you think about it, the blood in the lungs is going to move pretty easily unless there's stagnation in the heart, and that stagnation typically starts on the left side. So this can lead to pulmonary edema, lung diseases, cancer, emphysema, and additionally, going back to the idea of edemas, this is going to cause bloating in the GI region, as this is where the blood is getting kind of stuck and on its way back to the lungs. As you may know, the vessels that are carrying deoxygenated blood back to the heart to go to the lungs is going to be veins, and veins will compensate for increased blood volume. So they will expand, and it will get that fluid to kind of leak out into the surrounding cavities. And this is why we see bloating in the GI region. in patients with right-sided heart failure. And this is all due to that backup of the pulmonary artery. So in order to test for congestive heart failure, there are three different really categories. We have clinical, imaging, and we have chemical. Clinical is going to be things that a clinician could observe through either listening or looking at someone. Chemical is going to be through blood tests, and imaging is, well, imaging. So for clinical testing, a clinician might listen to the heart and notice abnormal heart sounds. These could be either a third heartbeat, which can actually be that leaking, or they can listen to a different sort of flow, and you're going to hear that turbulent flow, that blood flowing unevenly. Patients may also report a shortness of breath when lying down or bending forward. And a good way to think of this is if you have a water bottle, and you have it half full of liquid. If you were to bend it in half, and you were to have half the water in the bottom, half the water in the top, and you split it in half, well, now you don't have any water in the middle. And what this is kind of what's a metaphor? It's a metaphor for the blood in the body. So if the blood is in the feet and in the head, there's no blood in the middle, and that's going to cause the body to realize it doesn't have enough oxygen, not enough blood is moving. And this is going to cause the respiratory system to require more inspiration of oxygen. Another thing that's very common with heart failure is swelling in the ankles, feet, and abdomen. Again, we've talked about edema a lot, but that increase in fluid retention or fluid excretion from the vascular system into the surrounding environment due to that stagnation of blood and constriction of the vessels. Moving on to chemical tests. So in a blood test, a clinician might look for increased natriuretic peptides, and what this is a chemical that the body will use to retain fluid, and how it works is it's going to increase sodium excretion in the kidneys. If you remember from renal physiology, if we increase sodium excretion, that's going to increase water retention, because water is going to follow sodium. A good way to know what natriuretic peptides are for: Na is sodium, NAT, Na+. Another thing they might look for is increased hemoglobin concentration. So if going back to that hemorrhage example, the body's not getting enough oxygen. It needs to get more oxygen in itself. So what it's going to do is it's going to secrete that erythropoietin from the kidneys. Kidneys are going to make more... erythropoietin is going to cause increased red blood cell count. Red blood cells have hemoglobin. Hemoglobin carries oxygen. So if somebody hasn't had a major hemorrhage recently, and they're showing those elevated hemoglobin concentrations, that might be a sign that they're going through heart failure. And lastly, somebody might also have altered plasma volume. This kind of goes with both of the previous examples. That increased fluid retention from the natriuretic peptides, as well as the body responding as if a hemorrhage is going on. It's going to want to retain more plasma volume because it thinks it needs to produce more blood to carry more oxygen. When in reality, the oxygen concentration is actually fine. It's just the fact that the body isn't able to bring that oxygen where it needs to be efficiently. The heart is not pumping blood as it should. This was referenced in the papers I cited, is a thoracic impedance analysis. So what this is this is actually testing the conductance of somebody's chest. So if we think about what's in plasma fluid is water and ions, as well as proteins and other things. But the two main things here are water and ions. So what this is going to do, it's going to test the amount of conductance through the entire chest cavity. Higher conductance means there's going to be higher fluid content. And again, this is able to test through places that an ultrasound might not be able to look in as well. Just to get that enhanced justification as if CHF is happening or not. Moving on, there are some other things that can contribute to symptoms of heart failure. One thing that is noticed in cardiology clinics is that it tends to kind of be a seasonal disease. Not so much due to temperature or humidity, but more so to holiday seasons. So if you think about most feasting holidays, usually involves a meal high in sodium. As we talked about with the natriuretic peptides, increased sodium is going to increase the amount of fluid that stays in the body. So people maybe eating a 4th of July meal with hot dogs, hamburgers, brats, chips, what's going to cause is more sodium in the body. That fluid's going to be retained, and that's going to cause higher edema. So that higher salt intake is going to create more intense symptoms. And usually this is when people will come in thinking their heart failure has progressed, when in reality they just had a little too much salt, and that's making their symptoms worse. Secondly, sedentary lifestyle, or specifically bedridden patients. As we talked about in vascular physiology, when skeletal muscle contracts, it's going to pull that venous blood back into circulation. But if somebody's not having that activity and their skeletal muscles aren't contracting, that venous blood is going to start to pool. And like we brought up earlier with edema, when that blood is pooling, our hydrostatic blood pressure is going to increase, and the edema then is going to increase. So this is why you'll see people who are bedridden will have very swollen legs, toes, feet, ankles, and again, why it's pooling there instead of the chest cavity or the head is the chest cavity and the head need that blood to be moving. If we didn't have blood going to the brain, and that's where we had our vasoconstriction, that would result in death because the oxygen wouldn't be getting into the brain. And that's the body's #1 target for oxygen. However, there are ways to treat congestive heart failure. Although it is a chronic disease, there isn't a cure for it. There are ways to control it and monitor it. So firstly, as we talked about with the seasonal disease thing, limiting sodium intake can really suppress the symptoms. It can make the edema go down. That edema is also going to allow blood to flow a little easier. And it almost works in a more positive feedback loop kind of way, where the blood is able to flow easier, the blood's not stagnant then, and then we're seeing that decrease in edema. Increasing exercise, this kind of works in the opposite fashion of the sedentary lifestyle I brought up earlier. When skeletal muscle is contracting and is pushing that blood back into the system, it almost acts as like a second pumping mechanism. I know we talked about that in lecture, but it is good to remember. Controlling fluid intake is very important. So you may think if we're trying to decrease edema, as that's our #1 symptom, we want to get as low fluid intake as possible. However, if we were to do that, that would cause the kidneys to fail. And if the kidneys fail, that's very bad. You don't want failing kidneys and failing heart. So we typically will request between 50 and 64 fluid ounces per day, as that's going to be enough to keep the kidneys healthy, but not so much as to elevate the symptoms due to heart failure. Maintaining A1C levels is important, as well as limiting recreational drug use and drinking. Anything that's going to throw the heart off of its normal rhythm is going to increase our symptoms because the blood is trying to maintain a normal set point. It's that idea of homeostasis. If we alter that, the body is going to go to certain lengths to try to regain that. So if your heart rate isn't consistent, and you're not trying to maintain a normal, consistent environment, the body will do it for you, and that's what's going to cause these symptoms. Controlling blood pressure goes off that same idea of maintaining just a normal that your body can keep up with. And lastly, decreasing sugar and fat intake can be important in making sure that there's not other outside sources causing your heart failure to increase. So I'm sure many of you know that fat can start to cause plaque in the arteries, and that can act as constricting agents without the arteries and veins themselves actually constricting. It's going to increase that overall resistance, and the heart's going to have to work even harder than it already is with heart failure. Lastly here, these are just some pharmaceutical options for treating heart failure. Obviously, diuretics are going to help regulate fluid, and that's going to reduce the edema. However, ACE inhibitors and angiotensin II receptor blockers are also going to help stop heart failure symptoms at their source. Whereas diuretics are more in response to something, these other two drugs are going to be more proactive. So I believe these may have been mentioned in lecture, but ACE inhibitors are going to reduce blood vessel contraction by blocking the production of angiotensin II. If you remember, angiotensin II, what that does is that's going to cause vasoconstriction, or the constriction of those blood vessels and increasing that peripheral resistance, which then the heart has to work even harder, and that's going to increase those symptoms of heart failure. However, angiotensin II receptor blockers are just going to block angiotensin II from binding instead of stopping them at their production. Lastly, here are the sources I was able to use. My two articles are in here. My articles were able to help me with the imaging and testing slides, as well as just gaining some general information on how the disease and its research has progressed over the years. Thank you for watching, and if you have any questions, please do feel free to reach out. Thank you. Bye-bye.